Good afternoon. My name is Dr. Knows-It-All, and I'm here to inform you about your growing bodies. There are many young people out there, including you, who notice that there are changes occurring. Changes occurring in your daily life, changes occurring in your body, and you might not know what's going on. That's why I would like to tell you and take this time to tell you all about your growing bodies, specifically about female reproduction and menstruation, and things of that nature. Surely your parents and teachers should be teaching you all this, but since they're not around at the moment, I shall fill their shoes. Now I'd like to tell you there are certain things that you should know and terms that you should always keep in mind. That way you can make sense of this wondrous change in your lives, in your bodies. There are several terms that you need to know about, and I'd like to take this time to tell you about them right now. First of all, there's a little thing called puberty. It's the period of life at which the ability to reproduce begins. That is, in the female, it is the period when the female reproductive organs are fully developed. That's right. And it is the time that not only is it a change in your life, but it's a time when you yourselves can bring forward life. Although, maybe not yet. Your parents might have a problem with that. Next, we could talk about menstruation. This is the periodic shedding of the lining of the non-pregnant uterus through a bloody discharge that passes through the vagina to the outside of the body. It occurs at monthly intervals and lasts for 3 to 5 days. Yes, when we're talking about that time of the month, as so many people like to call it, that's what they're talking about. Although I would inform you not to use that as a sexist, pejorative thing to say to a woman that you don't agree with or you don't want to engage with. It's not very good. Next, we could talk about the menarche. This is the onset of menstruation, the first menstrual period. Then we'll talk about menstrual cycle. That's right. The menstrual cycle, also known as the female reproductive cycle, influenced by hormones like estrogen and progesterone, which I'll talk to you about in a moment. The menstrual cycle is a regularly occurring set of changes that occur in the female body in preparation for pregnancy. That's right. Preparation for when the stork comes. Brings you that bundle of joy, or bundle of sorrows, depending how you look at it. That's what the menstrual cycle is about. As I mentioned to you, there were these hormones that are in the female body. I'll tell you about them. Estrogen is one of the female hormones that promotes the development of the female secondary sex characteristics. And then progesterone, one of the female hormones secreted by the corpus luteum and the placenta. It is primarily responsible for the changes that occur in the endometrium in anticipation of a fertilized ovum and for development of the maternal placenta after implantation of a fertilized ovum. Which leads me to talk to you about pregnancy. Everyone knows what pregnancy is, but do they really? So I'll define it for you now. Pregnancy, as we like to call it, is the period of intrauterine development of the fetus, from conception through birth. The average pregnancy lasts approximately 40 weeks, also known as the gestational period. And I'll talk to you about some of the plumbing involved in this process of pregnancy and reproduction. First, there's the uterus. This is the hollow, pear-shaped organ of the female reproductive system that houses the fertilized, implanted ovum as it develops throughout pregnancy. Also, the source of the monthly menstrual flow from the non-pregnant uterus. That's important here. Non-pregnant uterus. Can't be a bundle of joy in there yet. Which I mentioned, the ovum, implanted ovum. What's the ovum? Well, it's just the female reproductive cell. Female sex cell, or egg, as we like to call it. Ovum, egg. Potato, ovum, egg. That's what we're talking about here. And I can tell you right now, there are more than one term that can mean the same thing. We have different terms that can mean the same thing. For instance, menses. That's right, menses is just another name for menstruation or menstrual flow. So be aware of that. When someone's talking about the menses, they're talking about the menstrual flow, menstruation. Which brings me to ovulation. Ovulation. The release of the mature ovum from the ovary, occurring approximately 14 days prior to the beginning of menses, or menstrual flow, as I said. Talk about the ovary, one of a pair of female gonads responsible for producing mature ova, eggs, in other words, and releasing them at monthly intervals. Ovulation. Also responsible for producing the female hormones, estrogen and progesterone. One of the female gonads. The corresponding gonad in the men and the boys there is the testicles. Next, I'll talk to you about the Graafian follicles, which is a mature, fully developed ovarian cyst containing the ripe ovum. Graafian follicles. Then there's the fallopian tubes. Let me tell you about those. They're one of a pair of tubes opening up at one end into the uterus and at the other end into the peritoneal cavity, over the ovary. And we have a substance called lutein. Lutein, a yellow substance which is high in progesterone and some estrogen. Lutein fills the Graafian follicle after it ruptures and the ovum releases. Which brings me to the corpus luteum. Corpus luteum, which is a yellow mass that forms within the ruptured ovarian follicle after ovulation, containing high levels of progesterone and some estrogen. It functions as a temporary endocrine gland for the purpose of secreting estrogen and large amounts of progesterone, which will sustain pregnancy, should it occur. Should it occur. Otherwise it won't, until the placenta forms. If pregnancy does not occur, the corpus luteum will degenerate approximately 3 days prior to the beginning of menstruation. Next, we can talk about fertilization. Fertilization is the union of a male sperm and a female ovum. Now, you may be wondering, how does that occur? Again, this should be a conversation between you and your parents. But obviously, they're not here talking to you about that, so I'll leave it to me. Apparently, there's this male organ called the penis, and it carries sperm. How does the sperm get from the penis into where it needs to go, which is the vagina? Well, I'll leave that to your parents to talk to you about. Let's move on. As I said, there are young women who are watching this who may not know what's going on with the body, and it gets to this point where you might start having premenstrual syndrome, or PMS as they call it. A group of symptoms that include irritability, fluid retention, tenderness of the breasts, and a general feeling of depression occurring shortly before the onset of menstruation. As I said, this is also called PMS. Be very careful. You don't want to be around a woman when she's on PMS. She might hurt you. And next we could talk about the cervix. This is another aspect of female reproduction and female anatomy. Simply, the cervix is the part of the uterus that protrudes into the cavity of the vagina, the neck of the uterus. Then there's menopause. As you get even older, as you get up there in numbers and age, you have what's called menopause, which is simply the permanent cessation, that is, stopping, of the menstrual cycles. Then you have the mammary glands, which is another way of saying the female breasts. Mammary glands, the female breasts. Potato, potato, as I said. I mean, you're never going to hear or read in a romantic novel or movie, "Hey, my lady, may I fondle your mammary glands?" Doesn't sound as kinky. Then there's something called the clitoris, which is the vaginal erectile tissue structure corresponding to the male penis. So you have the penis, boys, and you girls have the clitoris. As I mentioned earlier, there is something called semen, and this is a combination of sperm and various secretions that is expelled from the body through the urethra during sexual intercourse. Then there's testicles. That's where the the male gonads are. The male gonads are the testicles, or male sex glands, as we might say, responsible for production of spermatozoa, male sperm cell, and for the secretion of the male hormone testosterone. Then there's the penis, as I mentioned. This is the male organ of copulation. Copulation, as you may or may not know, is another word for sexual intercourse. Coitus, as we might say. Copulation, another one of those words where you're not going to see that in a romantic, steamy novel or movie. Want to come back to my place for some copulation? You're not going to hear it. You're not going to see it. But again, the penis, it consists of a base that attaches it to the pubic arch, a body that is the visible pendant portion, and a tip called the glans penis. Now the glans penis, is covered by a loose, retractable fold of skin called the prepuce, foreskin. Don't be ashamed if you still have your foreskin, boys. Nothing to be ashamed of there. And finally, we'll talk about ejaculation. What's ejaculation, you ask? Well, it's the process of ejecting or expelling the semen from the male urethra. And that's the juice that gets life a-going. It gets into that, well, I'll leave that for your parents. Well, I hope you found these terms to be helpful to you as you make your way through this play that we call life. And in this play called life, there are many changes in your body, as you are no doubt experiencing or will experience. And I hope that these medical terms will help you understand and make things a lot clearer and less scary. And again, be sure to talk to your parents, or try YouTube, or Google. Well, this has been another educational session with Dr. Know-It-All, and I will see you again on the flip side, as the kiddies say these days. And you have a nice day, and I'll talk to you soon. Bye-bye.